The GLP-1 market is fundamentally reshaping global healthcare. But despite the unprecedented clinical success of these metabolic drugs, the current pipeline relies almost entirely on subcutaneous injections. For global pharmaceutical companies, injectables present a massive bottleneck for patient adherence and manufacturing scalability. The true holy grail of the metabolic market isn't just better weight loss, it is oral delivery. But transitioning a GLP-1 drug from an injection into a daily pill requires overcoming one of the most hostile environments in the human body. Standard GLP-1 drugs are peptides, strings of amino acids that mimic the hormone our own bodies produce. When you inject a peptide, it bypasses the digestive system and enters the bloodstream intact. But if you swallow that same exact peptide, your gastrointestinal tract treats it exactly like a piece of dietary protein. Extreme stomach acidity and aggressive proteolytic enzymes shred the drug into inactive fragments long before it can reach the intestinal wall. The bioavailability of raw oral peptide is practically zero. To solve this problem, biotech are utilizing two distinct energy engineering strategies. The first is the shield. This involves co-formulating the peptide with a chemical absorption enhancer like SNAC. SNAC acts as a temporary buffer, locally neutralizing stomach acid just long enough for the intact peptide to slip through the gastric lining. The second, more radical strategy is the replacement. Instead of using fragile peptides, researchers have engineered synthetic, non peptide small molecules. Because they aren't made of amino acids, the stomach enzymes ignore them completely. They survive the GI tract, enter the blood, and successfully activate the GLP-1 receptors. Solving the oral delivery barrier will exponentially expand the reach of the cardiometabolic therapies, moving them from specialized treatments to accessible daily interventions. If your biotech startup is developing novel delivery platforms or small molecule agonists, communicating those complex pharmacokinetics to investors is critical. I translate dense clinical pipelines into clear, visually precise scientific narratives. Let's map out the mechanism of action for your next clinical milestone.